Our poor Tommy here, he is about 13 years old. We rescued him. He's a very pretty boy. First, he got diagnosed with urinary tract infections. The company Purina helped us with UR. Later, when he was about 12 years old, I would guess, or 11 years old, he got diagnosed with diabetes. Since then, we feed him with a DM from Purina. We feed him, he likes the Savoy Select with the gravy. And he also gets a lot of dry food. It does not hurt, we have other cats too, if other cats are going to eat it. I want nothing with his diabetes like his injections. I'm shaving his neck, since he is a long-haired cat, and I'm going to do a blood test every 4 to 6 weeks. Earlier we did that a little bit earlier, a little bit more often, once a week, because he was just diagnosed with diabetes. But now we can see he feels okay. We got the right units on his insulin, what is very important. And I am going to show you now how to do his blood sugar level. It's 6 o'clock. We start every morning at 6 o'clock. We start every evening at 6 o'clock. We have an alarm clock set so we don't forget about it. And what I'm going to do is I am going to check he's very relaxed because he knows nothing is going to hurt him really. Even he doesn't like the test on his ear. And what I'm going to do is I just scratch his ear with a lancer here like this, and then it starts bleeding. Okay, hold on, Tommy. And we use the Freestyle. That's the one, it works the fastest to get a result. Hold on, Tommy, hold on. It's okay, I know you don't like it. So that is before his injection. Yeah, going to be okay. There it beeps. We'll see what he comes up with. We started with 550 when he got first diagnosed. Now he is at 279 with a lot of excitement because he doesn't like that on his ear. That is actually not bad, 279. Uh-oh, Tommy, hold on. Going to scratch to clean your eye, your ear. Oh, okay. And now I'm going to shave his neck because we haven't done that for about 4 weeks. Sorry, I'm just so nervous. He doesn't mind to have that. There we go. And then we will go and give him his injection. What he is now on 4 units. We started with 2 units, but it's just a way you feel like, or you can see how he feels like. Uh-oh, there goes my alarm clock. Hold on. I'm going to turn it off. Hold on to him. Just sit there, Tommy. All okay. And he's a really good boy. Take his hair. There we go. Uh-oh. The ear is not bad. So I would say with all excitement, 279 is really not bad. He might be so about 200. See, he's going to lie down there. Any question, you just can send me an email. And on his neck, he is very not sensitive at all. That's how the mothers carry their babies around. That's why they don't have many feelings there. Okay, let's see, good boy. Let's get the insulin. I normally keep it in the refrigerator. I keep it in a towel so it stays all the way a little bit cool because you don't have to refrigerate it. We are with Lantus. And I am going to use the injections. I don't use the Lantus. Always keep an old one. I don't use the Lantus needles for it because there is no way I can really see if it came out or not. So I want to make sure. Here's a pen. Here is my little injections. I keep record of his insulin, of his diabetes, of his numbers. Here's his little injection. I use a little one, the Ultra Comfort. I go in here. I use my little light. I go with 4 units. These insulin syringes has also 4.5. I use a little loop. Since I'm older, I can see very well with my glasses even anyway. To make sure. Tommy is a really good guy. You can see he's just sitting there quiet, waiting. And I believe in the morning he even comes every time because he knows it does make him feel better. They know. So he is actually coming and asking for it. So here is my little touchy. It's very touchy. I'm very picky with that to make it really, really on 4 units. Because if you give too much, he can pass out, and you better have some syrup around in your house or honey to rub his gums with that. But we figured out he is doing the best with 4 units, what is actually pretty high. So you start what your vet recommends. I do not go very often to the vet because I just can see how he feels like it. And so why would I spend the money? I just ask and call for a refill. 1, 2, 3, 4, just a little bit more. I don't want to make too much. I don't want to have too little. And then I can just see how that goes. And you see, Tommy is still a very good boy. He's waiting because he knows it's coming. He doesn't even, because he knows it does make him feel good. And I always give him a little treat after that too. It doesn't hurt him at all. Okay, we are almost there. Make sure there are no air bubbles in. 1, 2, 3, 4. Okay, Tommy Shin, we are ready for you. Yes, we are. And here we go. And then I put it back in the refrigerator. Here's his neck. See? That's, he doesn't mind. Put it in there. In there. Goes there. There we go. I rub it a little bit. I smell if there's no insulin coming out. Always go straight. Don't go sideways, because I tried it first sideways, you know, like this. It comes out on the side. Oh, you are such a good boy. Nothing smells. There we go. He doesn't mind. You saw that. Let me see. Give him a little chicken. There's a little cricket up there waiting. Get the cricket on there too. There we go. Oh boy. There we go. You get your chicken. You deserve it. You earn it. I don't think I even want that. Yeah. There we go. I put the insulin back in the refrigerator, wrap it in a towel 5 times so it stays fresh, cool, not frozen. All done, I guess. Going to get his dinner.